Hey everybody, here we go. We are going to look at fractures and fracture repair in this video. So we'll look at what causes a fracture, what a fracture even is, and how fractures are classified. First, a little background. What's the difference between a broken bone or a fractured bone? Technically, there is no difference, even though the orthopedic community does not recognize broken as a technical medical term. So fractured bones or broken bones. You see some stats here just to give you some perspective. There's about 6.8 million per year in the U.S., and the average American will sustain 2 fractures in his or her lifetime. Right now I've had 0, so I'm ahead of the curve. Most common fracture before age 75 is a wrist fracture, and as you can imagine, mainly from falls. In those over the age of 75, though, hip fractures are more common, and this is going to be getting into a different cause of fractures that we'll talk about here in just a second. So the most common overall cause of fractures, as you might guess, is trauma, but there's also another kind of fracture called a pathologic fracture, and you see it here, pathologic fracture, that is termed, it's a fracture, it's a broken bone, but it's a fracture that's not due to trauma, but it's actually due instead to some pathologic or disease process of the bone, like osteoporosis. And when you look at the most common causes, as you might imagine, osteoporosis and tumors like bone cancer are common pathologic disease processes that can cause fractures. So when we talk about fracture classification, there's lots of different ways to talk about fractures, to put them into different groups and categories. Let's go through our list here of basic categories. One is the mechanism of the fracture. How did the fracture happen? And we just mentioned the 2 types there. Traumatic and pathological. Traumatic, obviously through trauma, through blunt force, twisting force, or pathologic through some disease process. Another way of looking at fractures is looking at the extent of damage to the soft tissue, namely whether or not the broken bone penetrates the skin. If it's a closed fracture means the bone does not come through the skin, also known as a simple fracture. But an open or compound fracture is when the bone actually breaks and penetrates the skin. It may be pulled back underneath into the skin, but if it initially breaks the skin, it's considered an open or compound fracture. Of the 2, open and compound fractures are more dangerous because of the risk of deep bone infection. That being said, you can have a nasty closed fracture as well. You also can look at a fracture classification based upon whether or not it's complete or incomplete. A bone that's completely broken all the way across its surface or across its either its length or its width is referred to as a complete fracture. If it's an incomplete fracture, the bone is broken, but it's not broken all the way across. You will also hear discussion about the direction or pattern of the fracture, and we'll see some examples of that in a second. Is the fracture linear, that is along a line? Is it transverse, that is across a surface? Is it spiral? Is it oblique, that's at an angle? So you can see some fracture classification based upon the pattern of the fracture, and also sometimes based upon the mechanism of the fracture, not mechanism like a pier, but mechanism as in the fracture actually resulted from a depression or a spiral kind of mechanism. Finally, there's some other ways of looking at fractures. Right there. You can look at fractures as being displaced or non-displaced. A displaced fracture means the ends of the bones are going to be off from each other. A non-displaced fracture is going to be when the bone is broken. It would be like this. It's actually now like that, but the bone is still pretty much in line with itself. A displaced fracture, rather, is going to be where the bone is going to be some distance away from, and therefore would not normally heal correctly and would have to be put back in line, and we'll look at that in a second. And finally, you'll see a classification of fractures based upon anatomical location, skull fracture, spinal, clavicular. Some are going to be very obvious as to where they occur, and you will see some fractures are named for people, like a Rolando fracture is a kind of hand fracture. A Coles fracture, I'll show you in just a second, gives you some examples of, so you may not know what a Coles fracture is unless you have actually seen that it represents a distal fracture of the arm. So again, this is just showing you all the ways that we classify fractures. And depending upon what you do in the medical field, you may have to know some of these in even more detail than you're seeing here. Okay, let me come up here. So I just want to show you some common types of fractures and discuss a little bit about how those fractures resulted, because again, this is a very common way of discussing fractures. A comminuted fracture, which you see up here, is when you have the bone broken into fragments of 3 or more pieces. This is a crushing fracture. You also see the term now multifragmentary. Comminuted is kind of going on the way out. But it's going to be a fracture. It's going to be a crushing fracture that's resulting in multiple bone pieces. So it's a comminuted fracture. A compression fracture is also when the bone is crushed, but this might be when you get the bone being pushed against itself. You see this when someone jumps out of a window, the house is on fire, they jump out the window, and they suffer a compression fracture of their vertebrae or a compression fracture of their hips. And you also see here, it's common in porous bones, like you'd expect to see in some cases of osteoporosis and pathologic fractures. Spiral fractures are going to be fractures we associate a lot of times with twisting actions, very common in sports. Someone's being tackled and someone's holding their leg and their leg is still moving, and you'll get this fracture where it's a little hard to see it. It looks kind of like it's at an angle. It's actually kind of a semi-spiral. It's sort of a twisted fracture. That's a spiral fracture. An epiphyseal fracture is going to be occurring in younger people, where that cartilage that actually is between the diaphysis and the epiphysis, where you would have the growth plate is still cartilaginous, and therefore it can be sheared off. It's not as strong as the rest of the bone is. So when you have the breaking of the bone there, then you're actually damaging some cartilage, and these can result in reduction in overall bone growth if the child or the young adult is still growing quite a bit. A few more types we should look at quickly here. Depressed is a very common term for bone fractures. Whenever the bone is pushed inward, we see this typically of skull fractures. If someone's hit in the head, then a part of the bone may get pushed in. The whole parietal bone may not get pushed in, for example, but a chunk of it might, and that would be a depression fracture. A green stick fracture, like you see here, is a fracture we also associate with with children, because the bone is going to break, but incompletely, much like a green twig breaks. Try to break a green twig from a tree. It doesn't quite break all the way. It kind of breaks on one side, and it kind of bends on the other. And you see this in children because their bones, while they are bony, are still somewhat cartilaginous. They still have, if they don't have a lot of cartilage, they still have a very prominent organic matrix. They have a lot of collagen in there, and the bones tend to be a little more flexible and bendy, so they can sustain more trauma without the bone completely breaking, as you see here. And finally, I do show you a Coles fracture. It's actually a fracture of the distal radius. If someone's trying to catch themselves when they're falling, then they can break off the end of that bone. And then once again, wrist fractures are relatively common before the age of 75. Let me just show you a couple other things about fractures worth noting here. Stress fractures are a little bit unusual because they are not usually diagnosed by x-ray. I happen to find a couple here where you can sort of see it, and you have to look very carefully to see a little bit of a chunk of the bone here being damaged. Stress fractures are often due to repeated stress on a bone, to where the bone has little micro fractures or little micro damage to it. And it's often hard to see on an x-ray because the damage can be so minute, but can still be painful. Stress fractures are often the result of overtraining. Somebody is trying to get ready for a race, for example, and they have not been a runner, and they put a lot of pressure on their bones, and because of that, their bones really haven't built up enough matrix for that, and you tend to develop these little micro breaks. So stress fractures are going to be small fractures, not a result of trauma, but a result usually of repeated motion or stress. And finally here, well, not quite finally, but almost, you can identify the fracture. I can give you a second if you want to pause, and then you can pick out the fracture types here. For example, we'll do one together. Okay, this will be of our two choices here, this will be a complete fracture. This would be an incomplete fracture. You can go further, of course, and I'll try to give you a little more detail when you look at these if you want to actually try to be a little more precise with your language. So if we're going to pause, you can do that in 3, 2, 1. And we're back. So again, this is going to be a transverse complete fracture. Here it will be, this is going to be an incomplete fracture. You really can't see a pattern to this fracture here. It looks a little bit like a green stick fracture, but it's incomplete. This fracture, of course, is multifragmentary or comminuted. Here is again, with our choices, this is a transverse fracture, and also it looks complete. This is going to be an impact fracture because, again, you are running the head of the femur into the acetabulum here. So that's the best way of classifying that. Over here, we are seeing, we'll start with this one. This is an oblique fracture because you can see how it goes at an angle. The spiral fracture is twisted, so that's why you have that shape there. Finally, let's look at this idea of why bone fractures are painful. Bone has no nociceptors. Nociceptors are pain receptors, so bone itself does not have that. Then why are fractures painful? At least that's what I hear. I've not had one. But why are they painful? Well, the bone itself doesn't have any nociceptors, but the periosteum does. So that membrane that surrounds bone does. So if you fracture bone, you're going to damage the periosteum, and you're going to get some pain from that. Also, when you have any kind of fracture, you're often going to get edema and pressure on adjacent tissues, and as those tissues get fuller of fluid, you're going to start squeezing on some pressure receptors. The other reasons, you tend to also have, with a fracture, you may get some muscle spasms. The muscles on either side of the break may be kind of pushing the bones, trying to kind of push them together, and that can be painful. And again, damage to nearby nerves and tissues. So not just the fact that you fractured your arm, but you also damaged some adjacent muscle tissue or some adjacent nerves. And all of these reasons are why fractures are painful. So the bone itself, the fracturing of the bone doesn't cause the pain. It's going to be all these other peripheral tissues, the periosteal tissues, the edema, the swelling, the spasms, and the damage to other tissues that results in that pain. In the next video, we'll look at actually how fractures are repaired and what can go wrong when fractures don't repair the correct way. Thank you very much.